Welcome back to Holistic Healing Association. I'm Erin Darcy. I'm certified in embodied processing and clinical hypnosis. Today, we are going to be touching on developmental trauma and chronic pain. I have an international head trainer for somatic experiencing, who's also trained in physiotherapy, psychotherapy, and it's an honor to have him. I would like to introduce to you David. Thank you so much for joining us. And would you like to tell us more about yourself?
Sure. I can tell you how I got to where I am professionally. This has been a multi-decade process. I started out professionally as a physical therapist, graduated from Stanford a long time ago, and did a lot of work with people who had major traumatic brain injuries, stroke, spinal cord injuries, et cetera, and worked with children in pediatric rehab. But I'd always been interested in psychology and sort of the underlying psychophysiological processes that were going on with physical disabilities, people with physical disabilities as well. And after several years working in that area of physical rehab, I started really dabbling in, training in, and then steeping myself in the world of body work, alternative healing arts, different names in different decades, say. And my work changed to working with people with chronic pain, doing a lot of hands-on work and other kinds of work as well. And decided I needed to go back to school in psychology to understand human behavior better. And I went back to California Institute of Integral Studies with a specialty in somatic psychology or somatic psychotherapy. And it was a wonderful program, and that's where I was introduced to Dr. Peter Levine, who developed somatic experiencing, the trauma healing work that I've been teaching for a long time. And that was in the early 90s or so, and I finished that up, and as they say, the rest is history, sort of. I steeped in somatic experiencing. I was assisting teachers and Peter also. Then I became faculty member some 20 years ago or so. So I've been teaching the somatic experiencing training all over the world for a long time, all levels of it. I've developed my own bodywork training as well. So I'm kind of straddling multiple fields of psychology and education and bodywork and healthcare, physical healthcare, etc. And yes, as you mentioned or alluded to, I also have been authorized by Dr. Levine to teach his master classes in somatic experiencing with areas of specialty, working with people who've had near-death experience, out-of-body experiences, chronic pain and syndromes, depression, aggression, developmental, and which is part and parcel of developmental trauma.
Okay, thank you. And is there a link between chronic pain and trauma?
Chronic pain and trauma, yes and no, and somewhere in between at the same time. So I'll take the easy part of it first. If someone's got a structural problem, an injury, let's say, from a car accident or even from abuse, physical abuse that's led to a structural problem, perhaps a nerve injury or a disc herniation or severe fractures of the bones, et cetera, that led to malalignments, et cetera. Some of that pain is organic in nature. And yes, if it happened in childhood and persists, it's by definition developmental trauma and develop pain from developmental trauma. But sometimes physical pain is due to the structural problems. Okay. Now, having said that, even with structural problems, we can begin to brace and hold and tense up around them, even if it's the onset is in adulthood, and that can lead to additional chronic pain problems. Let's go to the more complicated part of it now, which was your question was about developmental trauma and pain. And in part, it depends on the kind of pain. and its development over the years as well. And so the way it works, I mean, I'm going to simplify this drastically because it's very complicated. But let's say, for example, someone grows up in a household where they really have to be on guard. They have to be hyper vigilant. They don't know who's going to yell or when something's going to happen. They need to protect themselves, or et cetera, et cetera. They can navigate that in many ways, and one of those ways might be chronic bracing, tightening down, tightening up, but tightening. But it might be high at the beginning, but then becomes low level. And so that every time they get triggered by something, they might not even know what it is. There's a retriggering. Over time, that can lead to, for example, chronic musculoskeletal pain, fibromyalgia, and the like. Okay. Um, Over time, it might lead to more complex pain pictures that include, for example, irritable bowel syndrome. That becomes very complex. So the short answer is yes, they're related, and the long answer, I've given you only part of it, but a very, very important part of it. In fact, there are the studies done. They're called adverse childhood experiences
Yes.
studies. You've heard of these, where in the mid 80s, I think it was, a physician in one of the Southern California Kaiser hospitals was noticing patterns of medical syndromes, musculoskeletal pain, fibromyalgia, cardiovascular syndromes, gastrointestinal, etc. And he had access to thousands and thousands and thousands of medical records and started doing some research. And well, again, a long story short, noted a correlation between adverse childhood experiences like abuse, like food deprivation, food insecurity, name your ism, violence in the neighborhood, violence in the home, loss of parent, having to move a lot, etc. I think there were 10 of them. And in the research, found that if you have more than four, for every check mark over four, and there are 10 of them, there's I think it's like a one-to-one correlation with different medical syndromes in midlife, various times in midlife, but chronic pain is one of them.
Okay, thank you. And how can body work and somatic processing help people who have experienced developmental trauma, such as sexual trauma as a child or abuse?
Mm-hmm, mm-hmm. Well, first let's define what body work is from my perspective. The field of somatics, which includes many, 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 many different kinds of works. My own bodywork training base, somatic experiencing, bioenergetics, Feldenkrais. We can go through a huge list of movement education or somatic education practices, hands-on work, somatic psychotherapy approaches, etc. And the common theme in all of them is a learning from the inside, learning of self, learning from the inside, and it's a changing moment to moment, breathable, that's not a word, process. So we're in a constant state of change, and our felt sense, how we know us to be us, is it's a living process. And so the soma, which used to be defined as basically an object, is really a living, subjective human experience. The field of body work is another way to say that exact same thing, that there are various different hands-on ways to work with people so they can experience themselves, their body self, their ego, from the inside out. When we experience trauma, particularly in childhood, we may never really get a chance to fully embody, to fully come in, to really develop an authentic sense of self. And it becomes really essential at some point for people to dive into gently, slowly, not like a dive, kind of tiptoe into it, a re-experiencing or perhaps experiencing for the first time who they really are. I mean, it's sort of a cliche phrase, but the field of body work really can address that, depending on the kind of body work you do. But let me take a different approach to an answer to that question. Our first language is touch. Our first
Yes,
language is touch.
it's
It's
true.
not French, it's not English, it's not Arabic, it's not Hebrew, it's not Spanish, it's touch. And if if we have developmental trauma in our background, depending on readiness to receive touch, it's really important to consider that. So
That's
we're addressing people, we're working with people through their first language. Now, you mentioned specifically sexual trauma, and the question is often, is it appropriate to use touch work, body work, with people who have history of sexual trauma? My answer is it's absolutely essential, but the timing, the readiness, the trust, the safety, etc., needs to be in place. How does a practitioner know that? Sometimes you know it, you get it right, and sometimes you make repair, you apologize it, And the kind of touch, what's the intention? Is there informed consent with the client? Do they have the right to say, but even more importantly, the ability to say, stop, or let's change what we're doing. I'm too activated right now, or going in the wrong direction, right? So it's really a conversation, both verbally, but also with the hands, a physiological conversation, attunement. That's what I call attunement, physiological conversation, really sensing, are the tissues saying yes, or are they saying no? Because that may or may not be cognitively aware in a client's awareness also, right? So a really skilled practitioner, and this is one of the first things I teach in my bodywork training, is how do you have this conversation with your hands? Yeah.
okay. Thank you. And how would we start to help the client feel safe in their own body?
That is so client dependent. It's really got to be an individualized approach. I will often ask a client, what percentage of you is in the room right now? Right? And if it's less than 80%, that's a lot of information about comfort level or about triggering level. And so we'll do some work around presence coming into the body, coming into the room first. Work with boundaries. There's a lot of different ways to work with someone's boundaries, their personal space. Can they say, "Don't come closer to me. I'm not ready," or "You don't have my permission," or "I need you a little closer." But they can feel their physiological reaction to that. Even if I'm going to sit next to them, can I put my hand on your shoulder, right? Their verbal response might be yes, but I'm waiting for this to say yes. And until it does, I won't touch, right? So how do we know when they're ready? Sometimes we do, sometimes we don't. The more refined our attunement skills are, our listening skills, our clinical skills of all sorts are, the better we get at it. And a lot of times clients don't know. They don't know that they are ready. Sometimes they don't know they aren't ready.
Okay, thank you. And for people that experience disassociation, how can body work help them?
Well, let's first depathologize dissociation. We all dissociate. Everybody dissociates. We're all a little bit different at the grocery store than when we are in our therapist's office, than we are at home making dinner. So part of me's not here when I'm at the supermarket. I'm thinking, right? But you're talking about when things have gone in such a direction in somebody's lives that being present in the moment, feeling, being in their body, so to speak, um, has been dangerous. I mean, if someone's going to feel bad physically or emotionally or spiritually, who wants to feel it? So we leave our body.
Exactly.
And so, how can body work be helpful in bringing somebody back in? First of all, it's got to be a gradual process. Okay? And again, if you think developmentally, touch is our first language, but movement is our first, is our movement's our second language. Even facial expression, right? Movement, the sensory channel called movement is called proprioception. And I will often work with movement or even self-touch, proprioception first to help somebody's brain receive the sensory input that I have a body, that I exist. It might be some pressure, it might be resistance, might be even just taking 1 pound weights and slowly lifting them, feel the muscles work. Or tight your whole body, release it. Can you feel the difference? Right? In those ways. So there are numerous ways, but working physically is really helpful. Then so that's more non-touch body work, or it's somatic education. Then adding hands-on work, as I was saying earlier, when, how, etc., to be appropriate, can help a lot. And the kind of touch is important. If someone's pretty dissociative, I'll often use more firm pressure, not hard, not like, but firm, so they can feel I'd say so they can feel it. What I'm really saying at a neurophysiological level is the sensory endings, the pressure receptors are sending signaling into the spinal cord and up to the brain saying, I have an arm. Hey, brain, there's something here. The other part of the brain says, oh, that's my arm. Right? So sometimes deeper pressure, different temperatures when you take a shower. Can you feel the water hit your body? Right? Can you turn around and feel it on your back? Because it's going to feel different. Someone who's very dissociative may not feel the water until you ask them to. There are a lot of in physical therapy terms, we call them activities of daily living: brushing teeth, washing, cooking, functional activities like walking. Very functional. I'd like to bring it to very functional things on a day-to-day basis, not just clinically in the office, so that they can practice these sorts of things at home.
Exactly. Because even if we go spending time walking through nature, just noticing how it feels in the body. If we're eating or having a glass, notice how it feels going down your throat. Notice the first few bites you're eating, the smell, the taste, the texture as it goes down. And if we're not just doing it in clinical settings, but doing it every day, the process is going to start to happen a little bit faster, and it becomes part of our daily life.
Right, exactly. As someone feels or becomes more capacious for embodiment, and depending on the complexity of somebody's trauma life, trauma history, it can take a while to build that capacity. Excuse me, and that while needs to be respected. It's not a process that can be rushed, or it can be re-traumatizing.
Okay, thank you. And what's the best way to heal from developmental trauma and complex PTSD?
Oh, that's a simple little question, isn't it? I wouldn't, maybe I can shift the way you're asking it. What are some good tools, modalities, approaches to trauma healing that I have found most effective?
Okay.
Yeah, well, of course, I lean a lot towards somatic experiencing. I think it's one of the most brilliant trauma healing works there is. Peter Levine, who developed somatic experiencing, starting late 60s through the 70s, and it's building it. And we've all contributed some to it over the decades. Really founded a very gentle, very strong model for trauma healing. And one of the questions he asked early on was, why is it that animals in the wild don't get traumatized? We would change that language a little bit now to are less likely to get traumatized than human beings, because animals in the wild do get traumatized. But they're exposed to potential threats, mortal threat all the time. And so we looked at what their physiological reactions to threat and mortal threat are. And then that was part of the building the model, really understanding the autonomic nervous system and what that's responsible for, and a lot of other parts to it. So looking at a more natural, facilitating a more natural approach to trauma healing based on animal models, the neurophysiology and neuroanatomy of the nervous system, human interaction, behavior, and then this very complex theory called polyvagal theory that fits well with somatic experiencing. So there are a number of pieces that fed into it, and I can't stress this enough. It's done, to use his language, in a titrated way, a modulated way, based on what one's capacity for changes, for activation, and for deactivation and settling is while we're working with them. So I think somatic experiencing is quite brilliant at that. My own body work is a nice addition to somatic experiencing and to a number of other works. And there are other good works. SE is, I think, the best, but EMDR is brilliant work. Sensory motor psychotherapy is brilliant work. There are a lot of really good works. I just have a leaning, probably because I've been teaching it for so long and working with it for so long.
Okay, thank you. And after a post-somatic session, is there anything that we can do to help integrate and be able to rely in the space forward to help us heal?
Well, I think integration takes several forms. If, depending on the depth and the intensity of any given session, and if there's a very deep, intense session, 1 week, I don't usually try to make that happen for several more weeks. I will hold people back a little bit. And that's for one of the integration reasons. But toward the end of a session, there needs to be time, if you're doing hands-on work on the table or sitting psychotherapeutic model, get people up and walking in the office, do something functional. That's a way to begin integrating and transitioning from the office out of the office. When you leave the office, go for a walk. Go for a walk. Even here in New England, in the middle of the winter, I tell people, walk around the block once. Don't slip on the ice. Walk around the block once before you get in your car and drive home. Give yourself time to integrate your physiology and transition, continue to transition. And then if something's really changed, a deep understanding about self, a shift from more dissociative to more presence, and that feels like, wow, I'm different now. Or we have reworked a trauma experience, a shock trauma experience, let's say, that it might take several days, a week, two weeks to feel, oh, I'm different now. Or sometimes it might be 6 months later, and you look back and say, wow, I'm different than I was 6 months ago, but I'm only getting it now because I'm at this family event and I'm not reacting the same way I used to. So
Exactly.
integration takes many forms and takes time.
And that's healing. And that's the perfect example. I've experienced that. It's going into social environments and noticing your body and that you feel safe. Whereas
Your
before you may not have, and you may have felt very unsafe and very uncomfortable, and it takes time for healing.
Right, right. You might feel safe or safer, or you might not react in the same way that you used to, even though, it doesn't feel good being around these three family members, but I'm not reacting in the same way. Yeah,
Yes. Now it makes perfect sense.
yeah.
And one last question.
Yeah.
What advice do you have for everyone watching today?
Advice about a good
It's
meal.
up to you. If
Eat
you want
healthy.
to hear from you, this man has traveled all around the world teaching. He is an expert, and we want to hear from you today.
Okay, okay. I'll answer that, but I said, eat healthfully, and I actually mean that in part because if our ground substance, if we're planting seeds in soil that has no nutrients, it's not going to grow. We can do all the great healing work there is, but if we've got significant gastrointestinal problems and we can't break down and digest nutrients and absorb them back, it's going to go only so far. So I said it in jest, but I actually mean it. We need to eat healthfully. So my advice, if you even think that you have a trauma in your history, or you've got chronic pain, or you're just wondering after this interview or the others you've done in your series, Erin, that maybe the anxiety I have, or the depression, or the musculoskeletal pain, maybe it's trauma related, or maybe not. Find a trauma practitioner. Find somebody. Find somebody to work with. And I'll quote Peter Levine with this. Trauma, or I'd say the effects of trauma, don't have to be a life sentence. That it is changeable, that it's our reaction to, our physiological, our body reaction to events. It's not the events per se, but a reaction to them that get prolonged. And because it's a reaction, it's a verb, and a verb means it's changeable. An event already took place. It might still be taking place, but our reaction to it can be different. So find a good practitioner. Mental health, physical health, etc., often falls into the shame category. It is not. This stuff is a normal reaction to overwhelming circumstances, and there's no shame in saying, "Hey, I need help. I need help."
Okay, thank you. And it's also very common when a person is experiencing anxiety and is experiencing depression that it's trauma related. And if we can process our emotions and we can heal, we can start to heal, the symptoms of anxiety and depression can start to decrease and soften. And that's what healing is. The symptoms, it just starts to soften.
Yeah.
Well, thank you so much. It was an honor to have you.
You're very welcome. Thank you for asking me.
Thank you so much, everyone, for watching today. And if you like a session, I'm here. The information is below.